Roger Ponce is the second patient in the U.S. since FDA approval to have a new bionic eye surgery. He has checkups with his doctors here at the University of Michigan's Kellogg Eye Center. When he was 14, Ponce was diagnosed with retinitis pigmentosa, a genetic eye disease that affects 100,000 Americans. For over 40 years, he gradually lost cells that sent vision to his brain. But
on January 22nd, I had an Argus 2 computer chip put in my eye to help me see again.
I'm Tharan Jayasundara. I'm a retina surgeon at the Kellogg Eye Center. Along with Dr. David Zi8, we performed the first Argus surgery here at the University of Michigan.
the Argus surgery is for the most extreme cases of retinitis pigmentosa, and, according to the Foundation Fighting Blindness, is in a clinical trial for macular degeneration. Doctors implant a chip that sits on the retina, the back of the eye. This chip receives signals from a camera and then transmits them to the remaining nerve cells. The surgery won't help patients see faces or colors, but it should help them see shapes based off of shadows. For a year after surgery, Roger will retrain his brain and his body to interpret sight again, like finding white felt on a black surface with one of his occupational therapists.
Good.
Is that it?
You're right next to it. It's right here.
Just ask Ponce's wife what this means.
I mean, you have to realize he saw nothing in that eye, nothing. So he went from seeing nothing to being able to do these things. I know these things sound small, but they're huge. They're absolutely huge.
But even this didn't happen overnight. Once he had the surgery, Roger couldn't see right away because the device wasn't turned on yet. Over 3 sessions, doctors tested the chip's 60 wires one by one to make sure the signal from each one wasn't too strong. The first day, Ponce's doctors told him not to expect anything yet.
I actually went to see the first time. He actually was given the glasses, and he was using them, and that was fun.
They said, we're going to turn this on to test the chip in your head to make sure there's no pains or nothing. I was fine. They turned it on again, and out of my left eye, which they did, which I had no sight in before, as soon as they turned it on, I thought, is that a flashing light? Am I dreaming? Am I hoping? Or what? They turned it back off, and they turned it back on, and I just went, there's a light flashing on there.
It was emotional time, because the first time is seeing something work for a patient who never had vision before. That's for the last few years.
The surgery has made it easier for Ponce to do daily tasks.
Lately, I've been able to get up out of my chair in the living room and walk through the bedroom to the bathroom without putting my hands in front of me. I call it bebopping around the house.
Ponce says this system helps him see his cat, the lights, and his grandson run across the room.
My wife sneakily stopped in front of me, and I kept turning my head back and forth, scanning, that's what they call it, scanning with my head back and forth and up and down, and I could see light on both sides of me, and it was dark in front of me, and I kept thinking, there's got to be something there. So finally I just said, are you standing in front of me? And she said, yes. That was my wife, Terry.
Several months after surgery, patients can have monthly checkups and occupational therapy instead of weekly. These visits have already found, for example, that the receiver stitched under the white of the eye can push out a bit. To make sure it didn't break through and cause infection, the team did a shorter hour-and-a-half surgery, placing a patch over the bump, but still under the surface of the eye.
In terms of challenges during the recovery time, it's ensuring that there are no complications from surgery, that everything has gone well, and in Roger's case, everything did go well.
Jayasundara and his team had to be particularly precise in their measurements and remeasurements during the surgery, because the location of the receiver in the front of the eye limits where the chip can go in back. Not to mention, the surgery was 4.5 hours.
With time, as we get experience as well with this procedure, I think the whole procedure becomes easier.
That means getting color and better resolution. The surgery is FDA and Medicare approved, so in that respect, It's ahead of other retinitis pigmentosa treatments that are in more of a research phase, like giving patients functional copies of the gene they lack or by using stem cells. These bionic eyes now, though, are gradually becoming available at 12 centers across the U.S. As for the first patients who have had the surgery since FDA approval, Argus in its entirety is not a quick fix, but rather a process towards more independence.
I like seeing him less frustrated around the house, because when you're trying to get around the house and you step on the cat and you run into walls, everywhere you go, it gets pretty frustrating.
And from Roger?
I just want it to go faster.